So welcome to this week's edition of Medical Device Marketing Podcast. So today, me, Claudia Holy, are joined by Becca Brady. Welcome, Becca.
Hi.
So are you a marketer who is wondering how the regulations affect you when it comes to imagery? What can you and can you not show? Do you wish there was a really clear sort of, guide showing you what these actually say? Well, the great thing is, these regulations aren't actually that complicated when it comes to what you can and can't show. And when we're talking about that, we're talking about imagery. So I've asked Becca to come and join us today because Becca, you're a little bit of a ninja when it comes to the regulations, not only because of where you were in your previous job, but also you wrote that guide, that fantastic guide that is on our website that talks about all the EU, UK, and TGA regulations. So I think you're the perfect person to help us simplify what you can and can't show in your marketing materials.
Yeah, no, I also am a bit of a regulatory geek, so I can talk about this for ages. So yes, very happy to be explaining the ins and outs of it today.
Fab. Okay, so let's start right at the beginning, and we won't leave any stone unturned in a succinct and organised way. So first of all, what do we consider? And this is quite an eye-opener for me when I first realised this quite a while ago. What actually constitutes medical device imagery?
Absolutely everything that is imagery. I think people think it only means like their clinical imagery or their image within their sales aid. Is not that at all. It's actually any visual aid, any visual image you're using in your marketing. I think, the one that gets people the most is their logo. That is a visual medical device imagery if you're using it in that way. Your social media graphics, your website graphics, your animations, your photography. If it's an image and you are a medical device company, and you're using it to promote your medical device, it's a medical device image. So it's something that's really important to be aware of. Even things like the stock imagery that's on your website, that becomes a medical device image because it's helping you promote your medical device. And we'll get onto that in a minute about why that's important, that your stock imagery counts. But any visual element that you're using to promote your medical device in any capacity is counted as a medical device image by regulation standards.
Okay, so basically anything we can see is a medical device image. And that could be graphics, vector graphics, any type of graphic can be, or picture can be an image.
Yes.
So how do I know, as a medical device marketing professional, how do I know what images I can actually show about my product?
Great question. It is all about your intended purpose. So if it's in your intended purpose, you can show it the same way as you can say it in your copy. The same applies to your visuals. So I guess firstly...
Can I stop you a second? Yeah, first thing, what is the intended purpose? Actually, just break it right down just so that everybody knows exactly what it is.
Yeah, exactly. So your intended purpose is what your device does. It explains what your device does, but also who it treats, who it doesn't treat, who it can be used for. All of your clinical claims all are a part of your intended purpose, which is why when I talked about earlier about your stock imagery being important, because if your intended purpose says it's for women in their 30s and your stock image shows a woman in her 70s, that is not in line with your intended purpose. So that's why it's really important to understand the ins and the outs of your intended purpose. And you as a marketer won't have written this, so I can probably feel people being like, I don't know what it is, I don't know where it is. But your regulatory team will live and breathe their intended purpose because it applies to everything within the EU MDR and also outside regulatory bodies. So yes, understanding your intended purpose is really important. Know what's in it, because that is essentially the backbone of what you can and can't say.
So to look at more examples of how this applies to imagery. So you mentioned before that if your clinical data shows a demographic of between 20 and 40 years old, and you show a picture of somebody who is 70, that therefore would be misleading for your audience, which would mean it's not compliant. So you have to always show what's in that intended purpose. What other parameters could you see in your intended purpose that is worth being aware of when you're looking at imagery?
Well, firstly, the really good point there about being misleading, because that's the whole idea. It's about are you confusing your audience? Are you misleading them? Other places that I think you can see it is indications. So if, for example, you have an indication of a surgical tool or that goes up the nose, and then you have an image of somebody looking into an ear or something like that.
Which
I know,
hopefully you wouldn't be doing.
which you would be. Well, I have heard stories of surgeons using things off label, and they're like, "Oh, this does work in the ear, so I'm
True.
going to use it there." It does
Yeah.
happen, and I think if you get a picture of a case from a surgeon, and like, I loved using this tool in the ear, and you then post that as an example on social media, like, "Oh, what a great case study." That's off label. That's against your intended purpose. You have to use it. The picture has to show what your device is supposed to do. But I think the most common way I see it happening is with the people that are in the pictures. If you're taking, if you've got a bariatric product and you're saying that you've got to use it for a person above a certain weight, and then in your photography showing the device, the person's not, so she's 6 stone or 7 stone, they're clearly not a bariatric patient. That's misleading. So things like that, making sure that your imagery on your website represents the people that your intended purpose says you're going to be helping with your device,
and the outcomes they'll achieve as well.
Yeah, and
Really
the
important.
outcomes. Yeah, that's a really good point.
Yeah.
If you, I think, people always want to show patients living their best lives after their product. And, I think that's where you can end up being misleading. If you have a device that can improve someone's mobility by maybe 5-10%, but you shouldn't really be showing pictures of them hiking up Mount Everest, because yes, it's aspiring, but is it realistic? No, so therefore it's misleading. And I also don't think patients want that as well. I think patients want to see imagery that's, reflective of what they can actually do. But from a regulatory purpose, that could be deemed misleading too.
So you just need to think about all your claims and your intended purpose in all the different sections and say, does my image match all of these claims? And then if it does, you're absolutely fine. So it's quite straightforward.
Yeah.
You just got to know what that intended purpose looks like.
I think the other way of thinking about it is like, ask yourself, could a patient come to me and ask if they could use this device and I have to say no? So if my image, if a 70-year-old comes to me and says, "Oh, I can use your device," and you're like, "Well, actually you can't," then you've misled them. "Oh, after I use your device, I can climb Mount Everest." Well, actually you probably can't.
Yeah.
Then you've misled them. So look at the image and say, if somebody asks me, "Can I do that you've shown me in that image?" And the answer is maybe, or no, you can't use the image.
Yeah. And a great one, actually, a great example of claims data is when you look at weight loss claims or something like that. So if you have a device that says you'll lose 55% excess weight of your excess weight, and you show somebody who's lost significantly more than that, well, that's outside what your intended purpose is saying. So things like that, you can also fall aside from those. Okay, fab. So that sort of understands what we can say. It must be in line with your intended purpose, but not all countries are equal and not all regulations are equal. So what regulations or what other rules do people need to be aware of? Because when they're going into other countries, but also, platforms, things like that, what else do they need to think about?
So I always think about this, and if you've heard me talking about regulations before, you've heard this before, I always kind of talk about an umbrella. The EU MDR is your umbrella at the top, but then underneath that is the next layer, which is your local guidelines. And you need to apply to both. The EU MDR is a guideline. It tells countries how it's open to interpretation for how it needs to be applied. And, the UK, not the UK anymore, France, Germany, Spain, they can decide how strict they're going to enforce that. So it's really important to look at those country guidelines, because some are a lot stricter than others, and some, won't allow imagery using children, for example, or what they define as misleading they take to a strict level. So it's really important to understand what you can and can't say in that local country. But then also in the new age of social media, we also have social media people guidelines. Meta put a lot in place. A big one is about body parts being compared. So when it comes to weight loss, that's really difficult to do because they don't want to show weight loss side by side. I know we do see those on social media. They come down very quickly when they're an advert. Meta doesn't want that, or zoomed in body parts. So, people been caught out before. I know I've been caught out before. You put a close up of an eye and you think, well, it's not a close up of a.
And it's not because the other thing is it has to be graphic or seen as indecent by somebody else.
Yeah,
That's
so
sort of or grotesque.
Or indecent is one side, but then you're also not allowed to show zoomed in parts of body parts. And I think it's because they're trying to get people to stop doing zoomed in parts of your abs to make it unhealthy body image issues. But so I didn't think they'd count a zoomed in eye.
No,
they did.
I thought it was pretty.
Part. They cared. So if it's zoomed in on any body part, that's not allowed. A side-by-side comparison, some of the platforms are a bit more iffy on, especially if it's an ad. I think it's less iffy if it's a post that you're doing, more iffy if it's a paid promotional piece. But yeah, they're very clear in their guidelines. You can go and see. Also, Meta is a bit slower, but you can actually reach out to them and say, I'm going to put this out. Are you going to have an issue with it? So you can do all of those things to get it checked. I don't know the rules on what was formerly Twitter anymore. I don't know if Elon Musk has changed that. That's sort of an up in the air. But the others are quite transparent with what they want.
And they're all quite similar in a way as well, which
is
quite nice.
Quite similar. Yeah.
And it's actually the same with the EU MDR and the local country guidelines. Although the local country guidelines, many countries you can't advertise directly to patients, which will limit the imagery you can use. But actually, in general, as long as you're fair, you're transparent, you don't hurt anybody, and you're not misleading anybody, in general, you can do an awful lot more than people think they can do.
Yeah, you really can.
Yeah. Excellent. So I suppose the only other question is, how do these rules work internationally as well? So if you're not just going UK, EU, what about things like TGA, FDA, things like that?
They all very similar, TGA and FDA. It all comes back to using your intended purpose. In the FDA, it's called intended use, but essentially they're very similar concepts. And it's the same thing, making sure that you're not being misleading based off those. But it's really important to look at that. I know the TGA are a lot stricter on weight loss than anybody else. So yeah, it's really important to not only look at their guidelines, but also to look at their guidelines for your particular speciality. Now, they might not have one for yours, and if they don't, then you just need to comply with the generalised. But especially bariatrics, in a lot of countries, they have an additional guideline to follow. And I think that's just because in the new age of people being more body conscious and all of that whole element that comes into it, people are a bit more conscious, regulators are a bit more conscious about what you do and don't show online.
Yeah, and whether you can or can't market to patients.
Exactly.
Okay, excellent. So I suppose the next question is, in marketing, we are not experts in regulatory. So, we might know what the guidelines say. It's really important we understand what the guidelines say. It's really important we understand what we can and can't do, because that will allow us to sit closer to, where we can really make an impact while not actually going over into, not allowed grounds. Trying to think of the right word there. But, so if you think you've created an amazing campaign, you've got really killer imagery. You've got really great imagery. It says exactly what you want it to do. It's emotional. It relays a message, etc., etc. How do you make sure that you are definitely compliant and you are not going to get in trouble? Because as marketers, we do like to try and push the bar a little bit. But how do we make sure we don't go too far? Because it can have big implications.
So first, it's be in line with your intended purpose. I think that's what I say all the time. Always refer back to that. And second, make the regulatory department your best friend, and always check it through everything through with regulatory. And I know that, I hear it all the time. Marketing team goes, "Oh, it didn't get through regulatory," and I know that can be really frustrating that things don't get through regulatory, but it is there to protect you and the company and your device. So you do need to put everything through regulatory. But I also think understanding your intended purpose allows you to have a much better conversation with regulatory. Because if they do turn something out and go, "No, sorry, you can't use this," if you can turn around and be like, "Well, actually, it says this in the intended purpose, this is the claim for it, this is the image, yes, we can," it gives you a much better footing in that conversation. Otherwise, you just kind of have to accept that they've not accepted it, which is no fun. So understand your intended purpose. It makes you so much better in those conversations. Understand your claims as well, and then you can go in and get your amazing campaigns through regulatory without any stress.
Yeah, I think that's the biggest thing, though. We find that. I mean, the understanding intended purpose is probably the biggest game changer in marketing that you can have, because, as you say, you're then on a strong footing and you know what you can and can't do. And the same as understanding the local country guidelines, because although you're not the expert in them, as you say, if you can combine these two together, you know exactly what you can and can't do, and you're in such a stronger position. So it's certainly changed how we think about things, because we spend a lot of time understanding both of these things. So yeah, that's fantastic. Excellent. So, Becca, are there anything else, any other little nuggets that you would like to share during this podcast?
No, I think it is just go away and learn your intended purpose. And if you don't know where it is, a regulatory member of the team will be able to tell you, clinical will be able to tell you, drop them a message and they will be able to send it to you.
Yeah. And it's easier than you think. Once you've understood it, it's really good. Excellent. Lovely. Well, thank you everyone for listening to today's podcast. If you have any other questions that you would like us to talk about, please drop us a message on LinkedIn, email us, or go through our website. Otherwise, we look forward to seeing you next time. Have a great week.
Thanks, guys.